We're here with Dr. Mel Cusi, sports and exercise physician, talking about the hamstring and athletes and how it affects them. And you were telling me some interesting things about the pelvic platform.
Well, when you have somebody who has to run, athletes, football players, soccer players, whatever, you can compare the lower body to two long levers, which are the two legs, coming from a platform which is the pelvis. That platform is inherently unstable because when you run, you change how you impact, and sometimes it's the right foot, then it's the left, it's the right and the left. And that platform needs to actually be solid, and the bones have to be compressed at the time of impact when you load them, and that's how we call it. And this requires a very fine-tuned muscle system, which we can call core stability, because if that is not working well, then it puts extra strain on things like the hamstrings or even the groin muscles or the glutes. So many times the injuries come because there is a reaction from those muscles being overused because the original muscles are not holding the platform in the right position at the right time.
And I believe you're very interested in research in this area, and you have done a lot of that.
Yes, we have come to realize that the sacroiliac joint gives us many of the clues to this kind of pathology, because it's a joint that has different functions. It has to allow for some movement between the bones, but also needs to compress when you load them. That is, when you sit, when you stand, when you run, when you jump. And this is a combination of the muscles and the ligaments around the joint. And the joint needs to move in a particular way when you have to compress it in order to transmit load. And if you don't get the right combination of muscles and ligaments, it moves the wrong way and it puts the stress on other muscles and tendons, which are the ones that eventually become injured, like the hamstrings, like the groin, like the gluteals.
And I guess you would have seen thousands of consultations that's given you this insight.
Yes, well, we have done with several colleagues a lot of research on this, and we have diagnosed in excess of 3,000 problems with sacroiliac joint. The good thing is that most of them improve with an appropriate exercise program. A small minority may need some injections, and almost, well, in fact, very, very few require surgery, which is great news.
That is excellent. Thank you very much for that.